there are many areas of life that can be a real pain in the... And with that in mind, if you've ever said, I need to go to my doctor, and they tell you it's going to be weeks or longer to be able to get in, or you say, man, I just want to talk to my doctor, and they give you a hotline, and it's basically whoever drew the short straw that had to take that shift, and you're saying, God, there's got to be something better. That is a real pain in this culture. And with that in mind, that's why I have Dr. Dan Moore here from Revolution Medicine, aka RevMed. Welcome to the show, Dr. Dan.
Thanks. Thanks very much for having me.
Absolutely. I wanted to get you on here, honestly, because your model of doing medicine, your model of doing primary care, it really is revolutionary. It's a really great name. When I first heard RevMed, I didn't realize it was Revolution. My
DBA is not the easiest to get, but yeah, no. That's why I started calling it more Revolution Medicine.
Yeah.
I keep for a year it was RevMed. Now when I say Revolution, people are like, oh, Revolution.
Yep, Revolution Medicine. So what I was just talking about is some of the pretty common issues that people have in being able to get in to see their doctor. What would you say is the value of a conversation with your doctor?
Really, when you're talking about a physician, a conventional physician, you are getting as a doctor most of your information that you're going to use for diagnosis, not from a physical exam, not from a laboratory study or an x-ray. You're getting it from a conversation with the patient and about their experience. And studies on this, when they're done, physical exam is necessary maybe 13% of the time. The rest of the time, we're relying mostly on information that the patient tells us. So when you have a rushed office visit or a visit where the doctor is really not listening to you, there's a good chance that they're missing out on a critical piece of information, or they're missing out on the fact that you are you're trying to get a piece of information from them, and that's not where their focus is. And that's coming back to why this model, why why is it important to have the conversation? That's really the heart of the relationship,
right?
And that's why direct primary care has become a model that's increasingly popular among physicians and also among patients who've been able to experience it.
Right. I'd say a lot of times I need to be about 85% sure I know what's going on before I do the physical exam. So
that's exactly
like
right.
The physical exam is just a confirmation of what I think is already going on. And it's the same for you?
Yes. I would say most of the time that I am talking with patients, it is in my office, and it's not in the exam room. Now, certainly I take patients in the exam room because you need to do a physical exam sometimes, but a lot of times I think people don't realize that part of the reason for a physical exam is often so that a doctor can justify a certain billing code. So if they replicate or they do a limited physical exam, they can charge more to the insurance company for the visit. So a lot of times it's not necessary at all. It's not going to change anything that they're doing. And they sometimes aren't even really paying attention. So we see that a lot.
Right.
Is the physical exam is really a formality for some visits. And that's a waste of the patient's time, it's a waste of the doctor's time, and it gets in the way of having a conversation. They are invaluable when they're used correctly, but when they're just part of the expectation and they're just done as part of the ritual, it doesn't do very much for you.
Right, right. And that is the type of thing, these groups getting together and you're actually a better doctor if you can bill more and all of that stuff. That's lent a lot of people to not trusting conventional medicine. just, you have a poor experience over and over and over and over and over again, and then you get conflicting information and it doesn't help, and they're like, well, you must not have done what I told you to do. And there's all of these things. What, in your opinion, can we tell people that don't really trust conventional medicine? Why would they need to come to you?
Yeah, that is an excellent question. I think there's been an erosion of trust in physicians, probably starting since around the time I was born in the early 80s, and it's been kind of on a decline because increasingly doctors are spending less and less time with their patients. So not really getting to know them, they're not really getting to understand them, they're not really treating them like they want to be treated. They're treating them like, okay, I've got to get into this room, get out of this room, and write a note, and I've got 7 minutes to do it because I've been double booked, and the priority on the patient care based on that model is just so low that can only erode trust, because if somebody's not spending any time with you, not really listening to you, which is a complaint I hear a lot, you're going to be less likely to trust that person. Doesn't matter what their degree is.
Right.
If they're not showing you the respect of letting you take the time to explain things and to ask questions, you're not going to trust them.
Right.
I think additionally, there's the rapidity of the visits, but also kind of the assembly line that most modern practices follow, where it is a business model where the doctor's job is to get in and out of exam rooms as quickly as possible, which is why you're sitting in a room usually waiting to see the doctor for a while, and they come in, they pull a chart off the wall, they walk in, they look through that. Hopefully they're talking to you and listening to you. Sometimes they are, sometimes they're not. And then they'll say, okay, this is what's going on, and here's the medication I want you to try, or I want you to try this, and I'll refer you to see this person, or we're going to order this. And then they run out again. And it's a very unsatisfying experience for a patient. Frankly, it's unsatisfying for the doctor too, but slowly over a few decades, this is kind of the model that has resulted just from the way our healthcare system operates. And in primary care in particular, it's robbed a lot from the therapeutic relationship. And direct primary care is a way to try and restore that by saying, okay, the doctor is not going to be compensated based on how fast he can enter and exit a room. He's going to be compensated based on whether or not he's got a good relationship with you, and you are, feel like you're getting value out of it. That's the power of that model.
Right. Absolutely. That's one of the things that I actually say about my concierge memberships, is that it's really great to be able to get a doctor on the phone. But what's even better is not having to introduce yourself to that doctor.
Right. Yeah.
It's your doctor on the other end of that phone. So having direct primary care, completely different.
It's a very different experience when people will come to me and say, well, my insurance will provide teledoc service. And it's to say, that's true. What you're likely to get is kind of the equivalent of a phone bank. It is somebody that hopefully is going to have some of your medical information, but they may not. They're probably not going to know you. And that's very different from you calling or texting the doctor that you see all the time.
Right.
And a doctor who's not responsible for 2,000 patients, a doctor who's responsible for 400 patients. That allows you to spend a lot more time, and it allows me to be the on-call doctor for all of my patients. That's a big difference.
Yeah.
And you're also not dealing with somebody who's in that bank of providers who are taking that shift, whose job, again, is to get in and out of those visits as fast as they can. Yeah. And it's very easy to get care that doesn't really address the problem. to get care where you're not really informed as to what's going on and why the practitioner is doing what they're doing. So that's why we have an alternative.
Right. And that actually leads right into something we were talking about a little while ago, which is that functional medicine that has been really popping up the last, 10 years or so?
Yeah.
I started hearing about it, where it's all of the pieces of medicine that you used to do that have been shrunk down because of that model.
Right.
A whole other profession has popped up where doctors are focusing on just that now.
Functional medicine as a specialty, I totally understand why people are gravitating toward it increasingly, because they say, well, it'd be great to have a primary care physician, but I really like a functional medicine functional medicine physician because they're considering not just what medications I'm taking and what diagnoses I have, but they're also considering my mental health, my spiritual health, my nutritional health, my environment, my level of functioning in social relationships. That's all stuff that an MD, primary care physician, a family physician, an internist, or a pediatrician, that's what we are supposed to do. That is part of our job. We've just abdicated that because now we're focused on how can I code you, what if I don't have an ICD-10 code, and if you don't know what those are, consider yourself very lucky, that I can tack onto this visit. If it doesn't exist there, it doesn't exist. If you're not limited by that, it becomes, okay, I know you've got this horrible stomach pain that you've seen, 3 or 4 specialists for, but when I sit down with people and interview them for their intake visits, and that's what they're coming to me for, and then it's to say, well, you're talking to me about this stomach pain that you've had that's been recurrent, or this back pain you've had that's been recurrent, and you've seen a number of people for it, and nobody can seem to give you an answer for it. But you also talked to me about the fact that you had to move recently because your spouse of 34 years just died tragically. Wow. Suddenly, that you are, that you're still grieving for it in an active way that maybe you put. Now, that's an extreme example, but you see that
all the time.
And when you see that, it's to say, okay, we need to fix this problem by really going at the source of it, and by considering that holistic view of the person. It's what a functional med doctor is doing, but a functional med doctor, in my opinion, is acting as, what a medical doctor, a primary care physician, is supposed to be doing.
Right. And there's so much information that you get by looking at it that way that helps you to do your actual job, because as a primary care physician, I'm sure the way I always say it is that you guys are the quarterback. And if I, as a specialist, don't tell you what I did, how are you going to know where to pass the ball?
Our job is to take the information from every source that we can get, and it's one reason why I like having, when my short visits are 30 minutes, that's enough time for a conversation. Yeah. When I can get as much information, not just from the patient, but from the specialists, from other people that are being engaged by that patient, I can integrate that all together and say, okay, here's what we're seeing. I think that we're concentrating on the symptom, we're missing the cause, or at least we're missing a very likely cause. We need to be investigating that too. That's the role of a PCP, is to be the quarterback.
Yeah, that's great. I love the higher level of care, the higher level of concentration on the patients rather than all of this other stuff. I love it. Dr. Dan, tell them how they can get in touch with you.
Yeah, my website is RevMed.com. It's the easiest way to learn about the practice. If you're interested, you can click a button and that'll actually call my office line, which is my cell phone. You can register to become a patient. You can email me, however you'd like to get in touch with me. What I encourage people to do is come in, take a look around the practice with a meet and greet. It's a quick 30-minute chat to talk to you about how I operate. And if it's of interest to you, we move on from there.
Okay, that's great. So the next part of this is going to be what I call the painkiller closer. And we talked just like inside the actor studio at the end of the interview. There's a list of questions, and just helps people get to know you a little bit better. So, what is the best piece of advice you've either given or received or heard in your field?
It's very simple, and it is treat the patient as though they're a member of your own family. And that is something that, as long as I keep that in mind, I may make mistakes because I'm human, but I'm going to be there for that person in a way that can make a huge difference between other interactions they've had with healthcare practitioners.
Nice. What is the worst piece of advice?
When I told a surgery attending that I wanted to do family medicine, he was aghast. I heard from a couple of attendings, "You're too smart to do that," and this one just flat out said, "Don't do it. That's a horrible mistake," and it was probably the best decision I made.
Wow.
So
that is a great answer.
It was really bad advice, in my opinion.
Yeah.
So a lot of people, the joke is that if you do badly on the board exams, you're not that good in med school. You're still a doctor, but nobody's going to want you for anything. So go do family medicine because they'll take everybody. The reality is, psychiatry is better with that. Although, props to psychiatrists because they're amazing. I did not do poorly in my classes. I did very well on my board exams, and I absolutely wanted to do family medicine because I wanted to treat the whole patient and have a relationship with my patients.
That's awesome. How would you describe your purpose in life?
Purpose in life, that is a good one. I guess my purpose in life would be to... I always feel at my best when I am doing things to help others. My priority, of course, is my family. But my patients are always a close second. And I don't know what the purpose is, but I know that I feel most like myself and most in tune with existence when I'm doing things for other people.
I like it. I always feel like that second question, the worst advice, always leads into that question. Is like, what is your purpose in life? Because them telling you not to do it, and you wanting to have more of a relationship and see the patient as a whole, it seems like it just flows right in there. So I guess in that same vein, what is something that other people value that you don't?
What is something other people value that I don't? I guess recognition by prestigious organizations or groups. I've never understood that.
Like awards and things like that? Or?
Yeah, I guess it's more, people wanting notoriety. It's like, I don't particularly care if I have notoriety or not, or prestige or not. If the people that I come in contact with and that I'm interacting with think I'm doing right by them, or I'm, a decent person, that's all I really care about as far as reputation. I'm not looking to, have 1 billion papers published or something like that.
Gotcha. Okay. If you could make one law and everyone had to follow it, what would it be?
That's a good one. You must treat others the way you want to be treated.
I like it. I like it. The golden rule.
It's an old one, but
it's
the best one I've ever come across.
Okay. I like it. So this one, it's so funny. I get so many different types of answers from this one, but pick a media, right? Movie, music, book, podcast. What is one of those that you're really passionate about, and why?
Let's see, that I'm really passionate about. I guess, man, I feel like I watch and read so little these days. Owning your own business tends to do that.
Yeah.
Plus having a young one in the household. So I guess for me, the book, actually, it was one of the books we had to read in high school by T.H. White, and I think it was T.H. White, and it's The Once and Future King. And that was a book that I just remember feeling was such a profound, just not really commentary, it got at the core of what it meant to be human, and a human that wanted to do good in a world with so much injustice and that people are flawed even when they're trying to do good, and it's a tragedy that there isn't more good done, especially when so many of us are so passionate about wanting to help each other. And I think it touches on that in a very profound way, and in a way that is really makes you feel that you're not, what's the way to say it, that you're not alone in wanting to do the right thing, that is difficult sometimes, and that we make mistakes. I just thought it was the last few pages of that I remember being so profound, totally unexpectedly. Although it was a magnificent book all the way through, but it was just a wonderful piece of literature.
Wow. Have not read that. Believe it or not.
I haven't read it in about
like
20 years, but I still remember parts of it, but
wow.
Still to this day.
All right. We're almost done. Okay. The last question is, when you're done in life, in your profession, how do you want to be remembered? What do you want your legacy to be?
I probably thought about this as a younger person way more than I wanted to, but was something that kept coming back as, how do I want to be remembered? And I think the conclusion I came to was, I think this will sound kind of strange, but I think that everything is temporary. Even our memory, our legacies. Even if you think of the people who are remembered for thousands of years, even they'll be forgotten. And so I will say that the people I directly come in contact with, I hope if there's a memory that it is a good one, but that we are temporary. So I know I'll be forgotten. If I'm forgotten, that's okay. We're temporal creatures. We exist in a finite period of time. And the only legacy I want is to be a positive and helpful force for other people in that same shared experience we all have as mortal creatures.
I like it. I like it. Dr. Dan Moore, Revolution Medicine. Tell them again how they can get in contact with you.
So the website is RevMedRVA.com, RevMedRVA.com, and that has my contact information. Email's usually the best, and that's dan.moore at RevMedRVA.com. Moore is with 2 O's, an R and an E, and an M at the beginning. But the website's usually the easiest way to get a hold of me. Phone calls often go to messages. It's not because I don't want to talk to you. It's because I'm on call all the time.
Right.
Emails, asynchronous is almost always the best way to get a hold of me. But I do get back to everybody who's calling me. So,
okay.
But patients always come first, which is, if you're someone calling for an inquiry, it's going to be a while. So.
I get it. I actually have that as one of the FAQs on my website. Is why didn't anyone answer the phone? I'm like, well, because I work by myself.
You're calling me.
Right,
yeah.
Exactly.
But
you will get him.
The downside of it, yeah. If you're not a known patient,
Bottom of the line.
you do unfortunately get bumped to the back, and when it gets crazy, my patients know I got to triage everything. So the acute stuff gets done fast, and other things might take a little while. And if you're not a patient, it's going to take a little longer.
Yep.
But it all gets done.
So that is the way to begin to create that relationship. If you want to have a relationship with a doctor who knows you, who cares about you, who sees you as a person rather than a list of symptoms, Dr. Dan Moore, RevMed. Thank you.